up, we have a clinical presentation from Dr. Shrutika Kankariya. Let me just do a little introduction. Dr. Shrutika is an advanced medical retina, diabetic eye disease, and cataract expert. She is the best retina surgeon in Pune, India. Wow, wonderful. And we have her among us today live in the set. So I'd like you to welcome, with a round of applause once again, Dr. Shrutika. And please remember, if you're online, if you have questions, please ensure to put in your questions if you have any, because we will have a time of Q&A. Over to you, Doctor. Thank you.
Thank you. Thank you very much for the kind introduction and a warm welcome. First of all, let me thank Pastor for having me here and share my thoughts on the retinal diseases and the current trend of management of retinal diseases in Asia. I was very impressed by the work the VMS organization is doing, and I congratulate the VMS organization for reaching out to the needy, and I can sense how genuine work is happening under this organization, and would be happy to extend my services in ophthalmology in whatever way I can. Now moving on to the presentation, can we have the slides? So ophthalmology itself is a specialization, and retina is the subspecialty in ophthalmology. And if you have any questions in the middle of the talk, I would be happy to answer them, because what is most important is you understanding what I'm going to talk. I'm going to try to keep it as simple as possible, but do raise hands and be free to ask me if you have any doubts as we proceed. So our eye is, in real sense, window to our body. Our eyes do express our feelings, gratitude, love, fear, anger, and not only emotions, but it is window to the other diseases that happens in our body. Now, this is retina. This doesn't have a pointer, but I hope it makes sense. The orange portion you see is retina. It's the back portion of the eye. Our eye works like a camera. You all must have learned this as you were a child. Whatever appears in front of our eyes is carried to the back portion of the eye, and which an image of it is formed on the retina. It's an inverted image that is formed on the retina, which is carried by the nerve to the brain, and which becomes again inverted when it is seen by or perceived by the brain, the back brain or occipital lobe we call. So the entire circuit has to function rightly for us to enjoy right vision, clear vision. Now, what is so special about the retina? Now, retina is the only organ in our body where the blood vessels can be seen by naked eyes. So being a retina specialist, when I look into somebody's eyes, I can see those blood vessels. Now, no other organ we can see the blood vessels, and that's the reason it is window to our body. All the blood vessels related diseases like hypertension, blood pressure, blood cancers can be picked up even by looking up the retina in some situations, and they can be diagnosed. And most of the diseases which are blinding and which can be prevented occurs in retina or nerve, and most of them are painless and they occur gradually. And these diseases again can be picked up on a regular retinal examination. So this is a small introduction of what organ we are going to learn about, retina. All of you have heard of retina and have some knowledge about it? Oh, good to know that. So that makes my task a bit simple. Yes, so these are the common retinal problems. I hope I'm not blocking the slide. These are the common retinal diseases that we come across in India. Diabetic retinopathy, age-related macular degeneration, retinal vein occlusions, which can be either central or branch, Central Serous chorioretinopathy, retinitis pigmentosa. But I don't expect you to remember these names when you walk out of this conference today. But at least try to understand the gist of what I'm going to talk in future slides. So this is how diabetic retinopathy affects the retina. As we saw, normal retina is absolutely plain. But in diabetic retinopathy, the blood vessels get damaged. They become weak. Fluid egresses out of the blood vessels. They break open. There is bleeding. There is edema. And it is seen as red hemorrhages and the white spots, as we call it, exudates. Now, this is the early stage of retinopathy, and if the patient is seen in this stage, we can still prevent blindness. We can prevent deterioration of vision. This patient's vision is absolutely normal. Can you believe? The retina, there's so much going on the retina, but the vision is normal, so the patient doesn't seek medical advice, but the disease is progressive, although patient doesn't perceive it. And that's why a regular checkup for every diabetic, even if the vision is fine, is necessary and mandatory. Since you all work in outreach, this awareness needs to be spread by the VMS organization to prevent a worse disease that can happen if disease is not picked up at this stage. Now, when the patient becomes aware of the disease is this stage. When the disease is already advanced, there is hemorrhage, there's bleeding inside the eye, and suddenly the patient cannot see. As you see, the retina is completely crumpled and pulled up. We don't want to see patients in this stage, and unfortunately, being a retina specialist, I can say that most of the patients I see in this stages where I can only preserve the vision or prevent the patient from turning into completely blind, but cannot take him or her back to the previous good vision that he had. And this is most important thing. We want to diagnose and halt the disease at the right stage. So this is the big community work we can do together, is spreading awareness of timely diagnosis. Every year, every diabetic patient should get their retina checked, not just glass power checked at a spectacle shop. But the retinal examination with full dilatation is very important to prevent this disease. Now, since my talk is on current trends, fortunately, ophthalmology has progressed a lot from technology point of view, and we have several machines which comes to our ears to pick up the disease in time. This is the CT scan this is the machine which does the CT scan of the retina. You all must have heard about CT scan of the brain and the body, but we have a CT scan which scans the retina. That in the corner is the normal CT scan, where all layers of retina. Now this image, the retina has 10 layers, and you know how much is the thickness of the retina? 160 microns. So 1,000 microns make 1 millimeter. So it is so thin, but it has 10 layers, so it's that intricate, the organ. And that center point, which is 0.35 microns, which is less than half a millimeter, does 90% of a visual task. So you see how delicate retina is, and the entire retina come together and makes the optic nerve, which carries information to the brain. And when something goes wrong in the retina, we get such swelling, and it can be picked up on the OCT. Now, earlier, before we had OCT, it used to be very difficult to diagnose these patients, and eventually, most of the diabetic patients usually would suffer visual impairment. But now we have aids to diagnose these patients in time and treat them to prevent vision loss. So this is how the disease could be seen by us. Now, you all must have heard about angiography happening in the heart, right? But we do have angiography happening for the retina also. That is a normal angiography. So this is a blood vessel pattern which is seen in normal eyes in the retina. And this is what happens when a patient suffers from proliferative diabetic retinopathy. You see there are leakages, the blood vessels are, the microvasculature, that is capillaries, break open and they leak dye, the one we inject. In angiography, we inject a dye which goes into the entire system, and it's seen like this when we take pictures of the retina. So this is how we diagnose the disease, and then this disease can be treated either with injection that we give inside the eye. Now, most of the patients get terrified with the fact that, am I going to receive an injection inside the eye? And most of them would just not go for it, just out of fear. Fear is a big, as we all know, fear is the biggest enemy of anything good happening in this world. So they're very terrified with the thought, but we, as active medical volunteers, have to again spread this message that this injection is very, very safe and painless, because the injection is given by a needle which is as thin as a strand of hair, and it is absolutely painless. And this is how the swelling goes down once the patient receives the injection. There are other injections like steroid injections that can be given inside the eyes. In certain diseases, we need to give steroid injections also, which again are very well tolerated by the human eyes. For proliferative diabetic retinopathy, sometimes we have to do such laser on the retina, as you see here, which happens in 3 stages. And this laser therapy is a gold standard treatment for diabetic retinopathy, as this laser therapy almost negates the chances of complication of diabetic retinopathy like vitreous hemorrhage and retinal detachment happening in these patients. And once we do this laser therapy in time again, we are almost sure this patient won't go blind because of diabetic retinopathy. So this treatment is also very, very important as far as diabetic retinopathy is concerned. In certain advanced diseases, when the injection or the laser doesn't work, we have to do retinal surgeries, which we would not like to do, because this again is done to preserve the vision and is not a foolproof surgery to revive the vision. So we don't want patients to reach this stage, but if the situation demands, we do have to do retinal surgery as well. Coming to the next disease, which is age-related macular degeneration. Has anybody heard of this disease in the audience? Okay, the oldest one has heard. Okay. So age-related macular degeneration is a very common disease in the western part of the world, but now, since the life expectancy of Indian population is also increasing, is getting seen more and more commonly in India as well. So what happens in age-related macular degeneration is patients start seeing blurry patch in the center of their vision, and everything may appear distorted. The straight line of the door may appear wavy and distorted. Again, this symptoms is taken lightly by most of the aging population, and it should not be. Basically, any symptom of eye should not be taken lightly, because it could be a tip of the iceberg phenomena, and we could be dealing with much, much bigger disease behind, and it could be just start of it. And as I told you, eye being a very delicate organ, once we have lost time, we cannot revive much vision. So this is how, while reading, you may miss letters. The poles may appear wavy like this. So what exactly happens? This is the center part of the retina, as I told you, which is 90% of a fine visual task, develops such white spots, which are degenerating material called lipofuscin. And this is a dry variety, and this is the wet variety. In the wet variety, which is more progressive and more harmful as far as vision is concerned, would result into such hemorrhage again because of abnormal vessels in the center of the retina. Treatment of dry AMD is very easy. We just need to take some multivitamins, and the disease will lead to some moderate vision loss, and then the disease will plateau. But if it is wet AMD, then it can progress to give bigger patches of hemorrhages happening underneath the retina, as you see in this slide. And this can lead to a big black spot appearing right in the center of your visual field. And recognizing faces of people might get difficult, and reading, writing, even signing documents and all becomes a challenge. So even this disease, if diagnosed in time, we can treat it with intravitreal anti-VEGF injections. Serial injections are required. You see after serial injections how the disease has quietened. Now, the compliance is very important here. Patients should not leave the treatment in the midway and continue it sincerely for 2-3 years to maintain and preserve the vision. Third is retinal vein occlusion. As we saw, the retina has intricate blood vessel architecture, and this blood vessel can get blocked. Just like one develops heart attack, what happens in a heart attack is the blood supply of the retina of the heart is blocked. Similarly, if the blood vessel in the retina gets blocked because of thrombus or embolism, this is what happens. A splatter of hemorrhages occur in the retina with swelling in the nerve and the retina. This is because of central retinal vein occlusion. The risk factors for central retinal vein occlusions are hypertension, hypertension, diabetic retinopathy, abnormal lipid profile, raised cholesterol, raised homocysteine, and other diseases can lead to thromboembolic phenomena. Now, again, the treatment for central retinal vein occlusion is intravitreal injection in the form of steroids or anti-VEGFs, and the swelling again goes down with the injection. Fortunately, we have aids of these injections which does the job now. Say 15 years back, we didn't have these injections. But now we do have, so it's more and more important to pick up the disease in time because we have the treatment and we can prevent the ailment. A single blood vessel can get blocked, and this is how the disease is when the one blood vessel and not the entire, not the central one, but the branch gets affected, and which is called branch retinal vein occlusion. Again, the treatment is same. We give injection to reduce the swelling, and gradually this blood spots also goes away. Fourth disease is central serous retinopathy. Now, sorry for the image. There's a central fluid accumulation in the retina here. This occurs because of stress, and we are seeing more and more of this disease in young population who are stressed out. IT population and young people, as diabetes is increasing, similarly this disease is also increasing. This leads to central fluid accumulation under the retina. What we do for this disease is we do the angiography and we see where the leakage is. And when we do laser to the leakage, the swelling goes down. So lot of de-stressing activities is going to prevent this disease, and stressful activity is going to increase this disease. Fifth one is retinitis pigmentosa. This is again a very common disease in India. It's a genetic disorder and happens to the children whose parents had consanguineous marriage. Means marriage is happening in blood relations. Children of such couples can develop retinitis pigmentosa. So as you see, the entire retina has developed this black spots, what we call as bony spicules, because the rod cells in this disease get degenerated. So night vision is a problem in these patients. As the day progresses and evening onwards, these patients have difficulty in seeing things, especially in dark. Dark adaptation is a challenge, and not only in dark, but eventually even the cone cells get affected and the vision performance decreases in the daytime too. Now this can be prevented by spreading the message that consanguineous marriage is not a great idea, because there can be a lot of genetic disorders that can occur in patients, in children of people who get married amongst their own family. The treatment of retinitis pigmentosa, unfortunately, is not very developed. A lot of research is going on in this field, but we haven't come to any rocket science breakthrough here. What we do is give some multivitamins and vitamin A treatment to delay the progression of disease, but we cannot halt the disease altogether. So prevention is the best strategy which we can apply as far as this disease is concerned. So to conclude, retina is a very, very delicate organ, and most of the blindness and preventable blindness occurs because of retinal disorder. one should be very alert about any minor symptom happening in the eye, be it mild blurring. What patients usually say is only the distance I can't see, but I can see the near. But we should have zero tolerance level to any eye symptom and visit a specialist, an ophthalmologist. What happens, most of the patients would visit the optical shop and are rest assured about the vision being normal, but the entire eye checkup, which includes retina checkup and the nerve checkup, is important, where the eyes get dilated. And yes, high degree of spread of awareness about diabetic retinopathy is very, very important, because I see a lot of diabetic patients who become blind, are in their active working age, and the entire family depends on them for financial support. And if this man of the family cannot see, he has to lose his job. So not just the patient, but the entire family goes through depression. So it's a family disease, even if it affects one adult of the family. And it becomes a negative vicious cycle. It doesn't end here. The heart disease, the dialysis, is a huge financial burden. And I've seen families going into depression and down trail because of this disease, and it's easily preventable. And that's where the social organizations like VMS can play a significant role. So thank you very much for having me here. This is Asian Eye Hospital. And whatever help we can be for VMS, we would love to be. Thank you very much for having me here.